And once again, a very warm welcome to all of our attendees this morning. Thank you for taking the time out every Tuesday morning to join these Toolbox Talks, and a very special thank you, obviously, to all of those who make it possible for us to constantly update the information that we are giving you. You are always emailing us, sending us WhatsApp message, even calling us to let us know what is on your mind, what is currently happening, incidents, accidents, updates. Anything that you want to hear, we really appreciate that feedback, and please continue to do that. We do value your support and input. Now, just to remind us on the tips to continually prevent COVID-19, first one is please wash your hands regularly with soap and water, and then use alcohol-based hand sanitizer when this is not available. As a side note, we have still noticed on doing a lot of audits and going to do site inspections at a lot of our clients, we are noticing that they are still using towels in order to dry their hands after using the bathroom facilities. Please note that this is not allowed in terms of your hazardous biological substance regulations as well as your COVID-19 directives. We are not allowed to have any material towels in our bathrooms. At home, yes, that is fine because that is your personal side. But if you are at a company, you allow employees to go there or visitors to go, you have to use one of two things. It is either an air blower that can dry your hands, or you can use normal paper towel to dry your hands and then discard that paper towel straight away. So please know that. Please go and check your bathrooms to see if at your companies you do have a material towel. It needs to be replaced with one of those two options. The second thing is to avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Cover your cough or sneeze with a flexed elbow or tissue, and then throw that into the bin. Obviously not your elbow, only your tissue. And then obviously clean and disinfect regularly and frequently touched objects and surfaces. These are things like tools, especially in our vehicles, if you're getting in and out of your company's vehicles. And if you're sharing tools on site, I'll know a lot of plumbers obviously work in teams, in groups. And yes, you do have gloves on, but we also want to prevent cross-contamination from what we touch, and then how we are bringing this back into the office. Because remember, we could obviously bring back this virus to those who are safely protected at the office because we have touched an unclean surface while we are working. So again, please constantly look at how you are sanitizing and disinfecting your frequently touched areas. So this morning we are continuing with COVID-19. Obviously, we have had those reminders this morning, but we want to look at the COVID-19 resource update. So let's get straight into it. There's a lot to discuss. We couldn't take a look at the entire directive, but we just want to touch base on a few things, particularly on, are you up to date? Do you have the latest directives in terms of COVID-19 prevention and the combating the spread of COVID-19 in certain workplaces? Now, this was released just a few months back on the 28th of the 5th, 2021. A lot of people are still working on the old directives. That is fine. The old directives still stand. However, these directives are amendments to those directives. And we need to obviously ensure that we have the most updated and latest information on what the Department of Labor and the Department of Health requires us to do specifically within our workplaces. Now, there are only two companies that are exempted from these at the moment, those who are not allowed to be open during this time, which I don't think there's any company at the stage that is not currently operating. But if you are operating at the moment, then these directives affect you. Or if you are a minister in a different state and you have been given different directives in terms of legislation, and these would be those who do not fall under the OSH Act in terms of Section 1.3. So if you are currently working and you are not in any industry that you're exempted from the OSH Act or its regulations, then these directives and amendments to the directives are affecting you. Now, in the current directives, in this direction, there's been amendments specifically regarding how to handle workers who take the vaccine. But also there's the question to, are you going to make the vaccine mandatory within your company? Now, that means that you need to sit down and have a collective meeting, yourself, your employees, all management, and please include obviously all the health and safety staff as well, the committee members, your health and safety representative, managers, etc. And if you don't have this resources, or you don't know what to do or how to go about it, please reach out to us. We would love to assist you in designing and updating your risk assessment and COVID-19 plan to include the amendments that are in this new directive. So let us look at the first change, or the first amendment to these directives. Now, originally, Section 3, which was risk assessments and plans for protective measures, did not include a vaccine plan. However, the new directives state that your risk assessment must now take into account the operational requirements of the workplace, and whether the workplace, as it says, intends to make vaccination mandatory. Now, this means that a company is allowed to make a vaccination for COVID-19 mandatory for all of their employees. Please remember that we do not want to go against any person's religious rights, their beliefs, and even their current standing on the vaccination. But at the same time, employees must also give valid evidence of why they would not be taking the vaccine, especially if a company is going to make it mandatory. And so this collective meeting, where you must sit down together and discuss the vaccination, as well as who must get vaccinated in the company, needs to go underway as soon as possible. And the reason for this is, in terms of Section 3, it stated that within 21 days of this directive, which was already 2 months ago, we should have already placed this in our plans and in our risk assessments. So if you have not done so already, what is your current standing on the vaccination? Do you know whether you have to get vaccinated or not in terms of your company policy? If you have not written a company policy as yet, do you have a plan to draft a policy now to update your risk assessment, especially looking and identifying employees who have the risk of transmission through their work, or perhaps their risk for severe COVID-19 disease or death due to their age or comorbidities? And are you ensuring, according to your risk assessment, that vaccination is part of your safe working procedure? Now, this is one of the amendments that has come into place. So again, if you'd like those amendments, you can either look on the National Institute of Communicable Diseases. They will have a link to this, but very easy. You can send me a WhatsApp. If you've got my number, you can send me an email if you've got my email address. If you don't have any of those, just go to www.ohss.co.za. You'll find all our information at the bottom of the screen. You can send us an email, you can send us a message, and we will get these draft regulations to you. Now, the reason why we want to assist you in this is because it's a very touchy subject at the moment. Do we take the vaccine or do we not take the vaccine? So what are we supposed to be doing in terms of the vaccine? Well, the law is stating that it is really up to the management of the company. Now, why is that? Why is the risk assessment so important to understand why we should be taking it, why we should not be taking it? Well, let's put it this way. Let's say, for instance, that you are a person that refuses to drink alcohol. Because of your personal beliefs, you do not drink alcohol, and that is fine. There's no reason why anybody should be forced to drink alcohol. But that is your decision, and nobody can change your opinion. Even if you go out with friends, you can still have a good time, and nobody forces you to do that, and so it's still fun. Now, let's say that there is a requirement within the company for you to actually do something that is against your stand. For instance, you are having a celebration and you are required to now drink a glass of alcohol. Well, that would be going against your personal belief, would it not? Well, this is where it is very important for you to make your stand known before. You see, you've been invited to that party. Are you going to make your stand at the party when it gets handed to you and create a scene? Now, again, we're not saying that there's anything wrong with your stand. In fact, we respect your stand. But there is a time for you to handle the stand. You see, if nobody ever knew your stand before the party, it would kind of feel like you were then making or creating an issue around that situation. Now, how would you handle it? Well, you would handle it by getting invited to the party and immediately discussing your stand, stating that if there is going to be alcohol there, please know that this is my personal stand on the consumption of alcohol, and give your reasons for that, and then come to an agreement with that person or the host of that party. And I'm sure if they're good enough friends, they are not going to force you to do it. In fact, they should respect the stand that you have. Now, this is very similar when it comes to things like the COVID vaccine. But please remember that there is also something else to consider. When a company is sending out employees often to private individuals at their private home, to corporate clients where a lot of employees are working in order for you to go and unblock drains, to install plumbing, and you're going to be coming into contact with a lot of people, the client may request that because the vaccine is available and because there is such a high number of those still contracting COVID-19 or the virus that leads to COVID-19, they are ensuring that no one comes to their premises that does not have the vaccination. So yes, it's not taking the vaccination for yourself. It might be taking it for someone else, for their conscience, so that when you arrive on their site, they feel happy that you are protecting them, not just yourself. And so this is also something that we need to consider. A lot of my clients have stated that if we are not getting the vaccine, we will not allow to be auditing on their premises. Are they allowed to do this? Well, of course, yes. They are protecting their staff in accordance with their risk assessment. And if that is the case, we need to reevaluate our stand on the vaccine. And so it's very important for us to be not just open-minded, but to have all the information readily available for us to make a proper decision. So, companies, owners, business owners, CEOs, managers, you cannot just lay down the law and state that it is mandatory without discussing it with your employees. So please do so as soon as possible. If you need a mediator, we offer that service. We can sit on Zoom meeting with you if you want, and we can discuss the potential risks. In fact, if we go on to the next slide, based on the same regulation, it states that you must develop a plan outlining the measures that you intend to take to implement in respect to the vaccination of your employees, in accordance not just with this directive, but also in connection with the Annexure C of these directives. Now, the Annexure C is the guidelines if an employer makes vaccination mandatory, which means there are certain steps that companies must take if they are going to make vaccinations mandatory. Now, you cannot just make it mandatory because you have a strong feeling as a business owner that you are getting vaccinated and now your employees must be vaccinated. It has to be determined based on a risk assessment. It also must be placed into a plan, into your COVID-19 plan. So if you took our template plan that we gave out last year, you need to update this plan. It was in Word document. This risk assessment also was in Word document. And you need to now take this plan and update it according to what you have decided as a company, not as an individual, but collectively as a team within your company. Are you going to make it mandatory or not? And consider not just yourself, but consider others, consider your clients, and also consider the state of where our current situation is going in terms of what is going to be required. I know the government says it's not mandatory, and then there's certain places where you're not allowed to go in without having the actual vaccination. That does not necessarily mean it's mandatory. Just for some companies, they are stating their risk assessment is so high that they cannot allow any person, because of the amount of people that they have, the amount of comorbidities within the company because of those 60 years or older, or perhaps those who have been diagnosed with COVID before and are vulnerable. All of this makes it mandatory for the company not to come into contact with someone who perhaps has not had the vaccination. And so it is a personal decision. It is an individual decision, but also it comes down to what the company is going to decide on. So please, a majority will vote on it. That is obvious. When it comes down to management and employees, the majority rule is there. And then if it is mandatory, you need to work in accordance with this. But there is something else that Section 4 tells us we must do within these directives. Under Section 4, this is Section 4(1)(I), subsection 2. Employers must provide employees with the information regarding the nature of vaccines used in the country, the benefits associated with these COVID-19 vaccines, the contraindictions for COVID vaccines, as well as the nature and risk of any serious side effects, such as severe allergic reactions. Now, all this information is readily available. The National Institute of Communicable Diseases has a frequently asked questions sheet. You can download this and distribute it to your companies, to your employees. We are also going to, from IOPSA side, is design a little video based on this as well, giving you the leaflet, perhaps explaining what are the different vaccinations we currently have in the company, or in the country rather. Then what are the contraindications for vaccination, as well as the risk of some of the side effects. Now, we cannot cover everything because we don't have that much time, but we are going to make it very short and sweet for you to be able to assist the company and your employees in making the decision whether you are going to make it mandatory or not. Now, again, it's very important for you to sit down as a team and discuss why it's going to be mandatory, or discuss why it's not mandatory and only a personal decision. But at the end of the day, you have to ensure that your risk assessment and your COVID-19 plan align with these new directives. So we are not saying that you have to make it mandatory. Your company can take the stance, and please, it must be in writing, it must be documented. You can update your COVID-19 policy if you wish, because it states that if an employer is going to make it mandatory, then you must follow these guidelines, which means if you are not going to make it mandatory, then it is left up to each individual employee to make the decision. So if you are fighting a battle where it's becoming very difficult, then rather maybe take a look at saying that it is not mandatory for the company, but you are going to support all the employees who wish to have the vaccine, or take the vaccine rather. But please remember, there are certain things that you must abide by. Should you state that you are happy with an employee going for the vaccination, and this means that you must support your employees. So now I'm speaking to all the managers, all the owners of companies and employees. Please remember that this becomes a right of yourself in terms of COVID-19, that employers must provide certain support to their employees. And again, this comes in terms of Section 4, subsection 1.k, give support to assist its employees to register on the electronic vaccine data system registration portal for COVID-19, and also give employees paid time off to be vaccinated on the date and time that they may be required. Now, please remember, employers, if you do not make it mandatory and an employee wishes to go and get the COVID-19 vaccine, you have to support that employee. It is your duty. It is your responsibility. And if that employee takes the day off, either the morning or the afternoon, in order to get the vaccine, you are to help them, if they have not registered yet, to register if they are not able to, and to give that employee paid time off. This is not leave pay. This is not sick pay. This is a day off, excluding everything else from your basic conditions of employment. So please remember that time off, that date and time that they are required to go for the vaccination, is a paid time off from the company. This is a legal requirement in terms of your COVID-19 regulations. Now, obviously, the employee must provide proof that the vaccination has occurred. Now, just to give you a side note, during this past week, we have dealt with a few cases of employees staying off because they have symptoms, but not really giving any evidence of the symptoms. You see, they just phone in and say, I'm feeling a bit sick today. It might be COVID, I don't know. and the law says I'm not allowed to come to work, so I'm staying at home. And companies are saying, well, what do we do in terms of this? Others are saying, well, we've come into contact with someone who is COVID positive. And since we've come into contact with them, you have to give us time off. Well, is this the case? And how do you go about dealing with it? Well, I'd love to chat to you if you've had this situation, because the law is very clear in terms of your human resources department and what the basic conditions of employment allow. Should an employee show symptoms while they are at work, let's say it's Monday morning or Tuesday morning rather, they come into work and they write there, yes, they feel like they have some of the symptoms of COVID-19. The first thing you must do is isolate that employee and give them a mask if they do not have one, in order to protect themselves and you. You will isolate that person either at your company's isolation room, or you will send them home to be isolated, and they will be put on sick leave. So please remember, in this instance, it is not paid time off. It is sick leave in terms of your basic conditions of employment. If you do not have any sick leave employees, you've taken your sick leave, or you don't have sick leave, you've worked there too short, then you must take annual leave in accordance with basic conditions of employment. Now, if you do not have annual leave, then you are taking unpaid leave. Please understand that your company is not responsible for paying you if you are off sick, if you have not received any sick leave, if you do not have any annual leave. So please understand this. It is a COID, or compensation for occupational injuries and disease, COVID-19. In other words, if you did receive it because you are working in close contact with others and you might have received it through your work, you can request your employer to claim on your behalf to the compensation commissioner, which means you've got to fill out the WCL forms. You've got to go to CompEasy. You've got to fill out the documentation and claim from compensation. And while you are claiming for that, they will then assist you in getting your test done. They will assist you in either getting the vaccine. If you are going to be doing that, they probably will request you to do that. And thereafter, you can also claim for loss of income because you do not have sick leave, you do not have annual leave, and they may request you to go and claim from UIF instead of compensation, but most of the time compensation will pay out. And so there is a procedure to follow. But employers, you do have the responsibility to support employees. Employees, you have the responsibility to ensure that you are doing it in accordance with government directives. Now, the law is there for a reason, so that we do not fight as employers and employees. That is the last thing we want. We do not want you to become negligent in your duties as employees, and we do not want employers not to support their employees. Really, it's possible to work as a team, and if you are sick, genuinely sick, there is no reason why an employer cannot go the extra mile and assist you. We have had it. We've had an employee just this past week that was off for 2 extra weeks because of COVID-19. He got sick again, even after the vaccination, because of the side effects. And the employer decided to pay him just for that week that he didn't work, even though he had no more sick leave or no more annual leave. Now, this was a kind gesture on behalf of the employer. We're not saying that all employers are going to do that. Everyone's got different budgets. But if you are in a position to do so and you value your employee, there's nothing wrong with you doing that. But employees, please understand that if your employer cannot do that, there are regulations that assist you from government perspective, from UIF, from COID, for you to be able to be compensated at that time. Your employer is not saying no, they're not paying you. They are saying they cannot pay you, and they are following the law in terms of what they are legally allowed to do and not allowed to do. So please don't fight with one another. There is a means and a way. There's a way for support and there's a way for receiving support. So if you need any assistance with this, please get in touch with us. There's our information on the top left-hand side, safety@iopsa.org. We have seen many trying to get in touch with us, typing in safety@iopsa.co.za. Please, you will not get in touch with IOPSA if you send it to that email address. It must be safety@iopsa.org.org. If you are getting in touch with OHSS Consulting, please use info@ohss.co.za, or you can WhatsApp the number just underneath that, 0718752070.